Welcome to Organizational and Systems Leadership in Nursing. My name is Dr. Leodoro Labrage, but you can call me Dr. Leo or you can call me Mr. Leo. And I'll be your faculty for this semester. I'm truly happy and excited to work with each of you as we begin this journey together. This course is designed to support your growth as nurse and healthcare leaders and equip you with the knowledge and skills to navigate and influence complex healthcare systems. Now, throughout this semester, I'll be here to guide, support, and challenge you as you deepen your understanding and apply leadership concepts in meaningful ways. In this class, your experiences, your perspectives are very important because they're going to play an important role in shaping our learning environment. Therefore, I encourage you to stay engaged, remain open to new ideas, and take full advantage of this opportunity to grow both personally and professionally. I look forward to working with you and seeing the impact you will make as future leaders in healthcare. Now, for the course objective, this course provides foundational content of managerial leadership, organizational theory, and principles of economics and finance, as well as health policy and advocacy. By the end of the course, students will be able to first analyze current and classic organization theories, including organizations as complex adaptive systems. In this course, we're going to connect theory to real healthcare systems so you can see how organizations truly function in practice, not just in papers. The second objective is examine the impact of 21st century organizational structures on communication, innovation, safety, and workforce sustainability and effectiveness. Now, think about your current workplace. How does structure influence communication and outcomes? We're going to analyze that together. Number 3, use principles of systems thinking, complex adaptive systems, and policy processes to propose sustainable, cost-effective practice delivery models. This is where you start thinking like a systems leader, in which you're going to design solutions that are not only effective, but sustainable. The fourth one is explore administrative and clinical leadership strategies to address legal, ethical, and safety issues within healthcare systems. In this course, we're going to learn how to lead through complex challenges, balancing patient safety, ethics, and organizational priorities. And number 5, propose a solution to address an interprofessional issue in a complex organization. By the end of our course, you won't just identify problems. You're going to develop a leadership project that will help you to lead meaningful and collaborative project with meaningful solutions. In this particular course, we're going to use the Organizational Behavior in Healthcare by Borkowski and Mies 2021, as well as the Quantum Leadership by Albert and Pappas in 2024. But of course, in addition to these two textbooks, we're also going to utilize various articles related to the different topics assigned in this course. Now let's talk about the course calendar and schedule. This is an 8-week course organized into 4 modules. Each building on the previous one should develop your leadership knowledge and skills. Now, as you move through the course, please make sure to regularly review the course schedule. In the schedule, you will find the weekly dates, content, assigned readings, assignments, and due dates. Now, this document is very important because this will serve as your guide throughout the semester. So I strongly encourage you to stay aligned with it each week. Now let's talk about the assessment and evaluation component of this course. So students will be graded based on the following. First, online discussion forum, which is going to be 25%. In this course, we're going to have 5 discussion forums. The next component is your individual paper about organizational behavior, which is going to be 30%. And of course, you're going to submit a group paper. It's about the leadership-driven quality improvement paper, which is going to be 40%. Now let's talk about the discussion forums, which are an important part of this course. Discussion forums make up 25% of your overall grade, and there are 6 discussions, each worth 5%. These discussions are directly connected to your assigned readings. It's very important that you complete all the readings before you begin your post. Now, each week you are expected to actively engage in the discussion by both sharing your ideas and of course responding to your classmates' post. For your initial post, you should write at least 250 words, and that includes at least one reference and follow APA format. And you should be able to submit your initial post through Canvas by Thursday, 11:59 p.m. In addition to your initial post, you are required to submit or respond rather to at least 2 of your classmates' posts. Each response should be a minimum of 150 words, include one reference, and demonstrate thoughtful engagement. And this is very important. Before you begin, make sure to carefully review the discussion forum instruction, grading criteria, and of course the rubric. This will help guide the quality and depth of your responses. And most importantly, use these discussions as an opportunity to connect your course concept to your own experiences and practice setting. Now, discussion forums will be evaluated using this rubric. As you can see on the slides, there are 5 criteria. First is the integration of course concepts and theory. Students should be able to demonstrate thorough and accurate understanding of the course concepts, and the concepts should be clearly explained and effectively integrated into the discussion. The second criteria is critical thinking and reflective analysis, which means students should be able to provide insightful reflection and strong critical analysis of the situation or topic. The third criteria is very important about application to nursing practice or healthcare system. Students should clearly apply concepts to real-world nursing practice, leadership, or healthcare systems and proposes practical, well-reasoned strategies or solutions. Of course, for all discussion forums, students are expected to use scholarly evidence and EPA style. You should be able to integrate scholarly sources or course materials effectively to support your ideas. And of course, EPA formatting and citations should be accurate with minimal or no errors. In addition to posting, students are also expected to provide peer feedback. So one of the criteria is peer response and engagement, in which students are expected to provide thoughtful, constructive responses to peers that extend discussion, offer insights, ask meaningful questions, or suggest additional perspective supported by course concepts. Now let's talk about your individual paper, Understanding Organizations, Stakeholders, and Leaders' Collaborative Practice. In this particular assignment, students will explore how organizations functions by examining typical organizational behaviors within the context of stakeholder and leadership. In this particular assignment, students will be able to use organizational and leadership theories to analyze how leaders influence organizational behavior and how collaborative practice can be used to shift an organization in a new direction. In this particular assignment, these are different objectives. First, through this assignment, students will be able to demonstrate their ability to understand organizational behavior from a systems level and stakeholder perspective. The second one, of course, you're going to apply theory to analyze leadership stakeholder interactions. Number 3, propose theory-informed strategies for organizational behavior change. And number 4, describe how collaborative practice models support organizational improvement. Take note, assignment paper 1 is an individual assignment. In this particular assignment, students may choose any relevant healthcare settings. But of course, I would advise you to utilize your own context or healthcare settings where you personally witness or observe these organizational behaviors. Now, your paper should be clearly structured using the following sections. First, your introduction. This is where you will state the purpose of your paper, introduce your chosen organizational focus, and orient the reader to what will be discussed throughout your work. Next, the organizational behaviors overview. In this section, you will provide an overview of the typical organizational behaviors, particularly within the context of key stakeholders. Now think about how individuals and groups interact within the system. Then you will move into organizational setting and leadership. In here, you're going to define and describe a specific setting. It could be a hospital unit, it could be outpatient clinic, it could be public health, ER, long-term care facility, or even an academic institution. Be clear about leadership structure and environment. The next section is theory-driven change. Now, this is a critical part of your paper. In here, you will describe leadership strategies that can facilitate organizational behavior change. And this must be explicitly grounded in leadership or organizational theory. After that, you will develop your collaborative practice model. In this section, you will explain how a leader can foster collaboration and guide the organization toward a new or improved direction. Make sure to connect this with interprofessional practice models. Finally, your conclusion should summarize your key ideas, reinforce the importance of theory in understanding organizational behavior, and highlight the role of collaborative practice in leading effective organizational change. Now, as you work on this assignment, I want you to follow this required structure closely. And for more detailed explanations of each section, I encourage you to visit the Canvas assignment page, where you will find additional guidance, expectations, and the grading criteria. In addition to that, I have also uploaded an assignment template to help guide you in organizing your paper, and please make sure to use it as a resource. In this particular assignment, these are the set guidelines. The length should be 3 to 4 pages of content, not including the title and reference pages. And in this particular assignment, you are encouraged to integrate a minimum of 4 scholarly sources, such as peer-reviewed journal articles. And this is very important. Use headings that aligns with the rubric to structure your paper. Earlier, we've discussed the suggested sections. And this is very important. Make sure to utilize and observe APE 7th edition formatting for all sections, including both in-text citations and the reference section. Writing should be scholarly clear, organized, and free from major grammatical and stylistic errors. And this is very important. Use third-person academic writing style unless you describe specific examples from practice. Just before you start writing your individual assignment, I highly advise students to review the rubrics and the criteria. In evaluating your work, we're going to observe these criteria, which you can see in the PowerPoint slides. And these criteria corresponds to the different headings or suggested sections in your assignment. Another important assignment in this course is your leadership-driven quality improvement paper. Take note, this is a group assignment. In this particular assignment, each group identifies and analyzes a quality or safety issue in a healthcare organization and analyzes how leadership could address it. Now, examples of organizational and systems level and leadership-driven issues appropriate for this assignment may include, but not limited to, first, it could be medication error related to workflow design. or it could be communication failures between nurses and physicians, or it could be delayed response times in long-term care facility, poor adherence to evidence-based practice, fragmented care coordination across disciplines, or it could be inadequate reporting of safety events. Again, these are just examples. You might probably think of a different quality and safety issue for this assignment. Now I will walk you through the key section of the paper so you have a clear understanding of what is expected. Now the first part of your assignment would be an introduction. For your introduction, I want you to begin with a strong opening that emphasizes the importance of quality improvement in healthcare. In here, I want you to discuss how leadership plays a central role in addressing organizational problems and briefly touch on how organizational behaviors influence quality and safety. Then, clearly introduce the specific quality issue your group has selected. You may include a clear purpose statement to guide your paper. For example, the purpose of this paper is to analyze the issue of increasing medication administration errors in the cardiac step-down unit and propose leadership-driven strategies grounded in organizational theory to improve patient safety. That is an example of a purpose statement in your introduction. Now, the next section of your assignment would be the quality improvement problem. In this section, I want you to clearly define the quality or safety issue your group is focusing on. In here, you might wanted to describe the scope of the problem, including the trends or frequency. For example, rising falls among older adults in long-term care facility. You might probably include the statistics, prevalence, incidence rate. Or you may address any ethical or legal considerations such as patient rights or reporting requirements. In here, you can also discuss workforce accountability, how staff may contribute to or be impacted by the issue, and explain the broader organizational or system level impact, including financial or operational consequences. Now, this is very important. Make sure to support your discussion with current literature or course reading. The next part of your assignment is your proposed solution or intervention. Here, you will describe the evidence-based intervention your group is proposing. In here, I want you to clearly explain what change will be implemented, who will be involved, and how this intervention addresses the root cause of the problem. Now, this section should be concise but comprehensive, typically 1 or 2 paragraphs, and it should be supported by scholarly evidence. Now, in the slides, you will see some of the examples of those proposed solutions and intervention, again, depending on the problem that you have identified. It could be implementing a standardized communication tool if the problem is related to communication, or launching a team-based care coordination model if the problem is related to care coordination, or it could be developing a structured preceptorship program to reduce turnover, or it could be introducing barcode medication administration workflow, and that if your problem is medication error, or it could be establishing an interdisciplinary ethics huddle. Again, your intervention would be very dependent on the evidence that you're going to locate and the problem that you have identified or going to address. The next section of your assignment would be the innovative leadership strategy. In this particular section, you need to focus on how leadership will support the implementation of your intervention. In here, I want you to include innovative strategies, such as, for example, the use of technology or new care models, along with leadership approaches like transformational leadership, authentic leadership, or servant leadership. And I want you also to consider system-wide strategies and interdisciplinary collaboration methods that will help drive success. In here, be sure to connect your strategies to course concepts and literature. The next sections of your assignment would be theoretical application. Now, what do you expect to write in this section? Now, I want you to select one organizational or leadership theory to guide your proposed change. And I think in our previous discussion, we talked about different leadership theories and different change theories. First, I want you to briefly explain the theory, what it is all about, and what its relevance to organizational behavior. Then, I want you to apply the theory to your intervention. More specifically, I want you to describe how it informs leadership actions, supports change implementation, and helps engage stakeholders. In this particular section, you should be able to demonstrate your ability to connect theory to practice. The next section of your assignment is about overcoming barriers. In this section, I want you to identify potential barriers that you might face or encounter when you implement your intervention. It could be resistance to change. It could be communication challenges. It could be conflicting priorities. Now, after you've identified those barriers, I want you to explain why it may occur, and I want you to propose a strategy to address these barriers. It could be communication plans, it could be staff training, coaching, or strategies to promote psychological safety and team engagement. And finally, you're going to end your paper with a strong conclusion. End your paper with a summary of the key points of your analysis. I want you in this section to reinforce the significance of the quality issue, and of course, I want you to highlight the critical role of leadership in shaping organizational behavior and driving sustainable change. Now, what are the different expectations and guidelines in this assignment? First, your paper should be 5 to 6 pages in length, excluding the title and reference page. Of course, you must include at least 4 scholarly sources. It could be more. And follow the AP 7th edition guidelines. Your writing should be clear, organized, scholarly, and the logical flow across section. And of course, in your document, in your assignment, I highly advise you to use appropriate headings aligned with the rubrics. Now, for complete details and the expectation, including the grading rubrics, I want you to visit the assignment page in Canvas. In that particular section in your Canvas, I have also provided an assignment template to help guide you in organizing your paper, and I want you to make use of that assignment template as your resource. So here's the rubric that I'm going to use to evaluate your work, and you can see on the slides right now that the different criteria corresponds exactly to the suggested headings that I've mentioned earlier. And make sure when you start working in your assignment that you have thoroughly reviewed the rubric. Now let's try to explore the Canvas site. When you open our Canvas site and NURS 5373, this is exactly what you're going to see in the home screen. You will see a welcome note, and you will see quick links to the different modules in this course. And I want you to be familiar with the different sections of this Canvas site. An important section of your Canvas site would be the simple syllabus. And I highly advise you to look at the simple syllabus. Go through it. It is a document where you can see many details about the course, including the course description, the learning outcomes, the different resources that we might be needing in this course, as well as the different assignment and assessment and evaluation component. Another section of your Canvas is the modules, and this is one of the most important part of your Canvas site, where you can exactly see the different tasks and activities and modules that you need to read and complete within the semester. If you try to click the modules, you will exactly see different sections of the modules. And in here, you can see the different modules for this course, as well as the different resources that you might probably use as you complete this course. Another important section of your Canvas site is the module tab. Now, when you hit the module tab, this is exactly what you're going to see. And here you will see the different modules for our course. In addition to the modules in our courses, we also have other important tabs like Getting Started and Introduction to the course. And again, I want you to explore all these sections in your Canvas. So on the slides, you will see one module. So this is module 1. So what are you gonna expect when you hit module? So every module contains a lot of information. It will exactly tells you the module overview, the learning objectives in that particular module, and the required readings will be there as well as additional resources. On the bottom part of the module, you will see coursework that you need to complete and the assignments that you need to submit. Now, another section of your Canvas site would be the assignments tab. This is very important, and I want you to check this section. This is exactly where you can see the different course requirements. In our particular course, when you hit assignments tab, you will see 3 sections. You will see the discussion forums. In here, you can see 5 discussion forums. And you can also see here the different course requirements, such as paper 1 and paper 2. Now, when you hit the discussion forum, this is an example of the discussion forum, and I want you to be familiar of the structure. All discussion forums have similar template. Now, once you hit the discussion forum, you will be directed on this page. At the beginning of the discussion forum, you will see a highlighted sentences, and that is very important, and I want you to read it. And it says, before responding to prompts below, please complete all assigned readings and thoroughly review the discussion forum instructions, criteria, and rubric. After that, you will see the objective of this discussion forum. And after the objective of the discussion forum, you will clearly see the detailed instructions, the different expectations from the students, as well as the required peer response or feedback. Now, on the bottom part of the discussion forum, you will see a highlighted note, and that's very important because it will tell you exactly when are you going to post your initial post and where are you gonna provide a peer feedback to your classmates. Now, when you hit the 3 buttons on the other side of this page, you will see the assignment rubric details. And when you start working in your discussion forum, I want you to review the rubric for this specific discussion forum. Now that brings us to the end of our video orientation. If you have any questions or need support at any point during this semester, please don't hesitate to reach out. I'm always here to help. I'll be working alongside you throughout this course to support your learning and growth. On the screen, you will see my room number. If you wanted to personally communicate with me or talk to me, or alternatively, if you wanted to communicate through email, I have provided my email address on the screen. I'm really looking forward to getting to know each of you and seeing all that you accomplish this semester. Together, let's make it a great experience together. Thank you so much.